Testing, 1, 2, testing.
This is the Fallbrook Regional Health District, Wednesday, July 16th, Strategic Planning Committee meeting. I'm calling it to order and asking for a roll call.
Director Jeffries.
I am here.
Director Ecclestaff.
Here.
Thank you.
Thank you. Do we have public comments lurking?
None.
Okay. All right. Today, we are going to embark on one part of strategic planning. We're going to check in with each other so that we can go back to our board colleagues and say, we've digested strategic priorities with the staff, and here's what we think should go into our strategic plan for 25, 28. You try to do 3 years out, but we're gonna just concentrate on the first year.
Okay.
Okay? So when we decide the strategic priorities, that means it gets more time, attention, and resources. And that other things don't encroach on that. Unless we come back together and like COVID, we had to shift everything. Now, it was too dramatic for everybody. You had to do that fire district too, I know. Okay, so we have some big categories here, and then I'll ask you to look at the handout that was just given there. And we're checking in to see if we're on the right track. Wordsmithing can be done. But the core part of the ideas here is what we want to make sure is the right place to go. So, program development, clinical services, facilities, expansion of current services, governmental requirements, and reset the reserve level. I'll talk a little bit about that since it's kind of new for you. So there are a lot of things we could be doing. And Teresa, of course, I'd like your educated eye on this. Of all the things you could be doing down there, in addition to continuing on. Unfortunately, continuing on isn't a strategy. But you continue on, right? Do these 4 seem to have enough gravitas for our board members to feel that we're pressing the program development in a good way from your point of view?
I think so. I think they're in line with what we've been exploring and the directions that match up with what we're hearing from the community too. And especially like the family offerings that were more well-rounded, you know, in all demographics. So.
Okay. And could one of you tell us a little bit about the emerging diabetes prevention program for youth, which we won't see blossom in 25, 26, but we want the on-ramp, so we're good to go. Could one of you talk to us about that?
I'll start with where I've got, and then if you want to lead from there, because obviously you take the point at that point. The Skinny Jean Project, also known as the J. Moss Foundation, right? They're the folks that we contracted with to get us trained, and then they run the data behind our current diabetes prevention program, right? They had an opportunity to work with several partners and get grant funding to investigate creating this same kind of CDC level track, but for families, so that it would actually include youth diabetes, right? Right now, the regular DPP program really focuses on adults only, knowing that childhood diabetes is also problematic. So they received this grant. They've been working with our team to really set up some basic protocols and to really start developing the curriculum of what that program would look like. So we get to be their flagship partner in the development and eventual launch of this program. Anything?
Yeah, no, I think that sums it up.
Okay.
It gives our diabetes program a lot of depth because now we have diabetes prevention. We have education for those who already have the disease of type 2 diabetes. And now we're going to layer on youth. So it puts us at the cutting edge of fighting diabetes in communities. And they chose us out as a partner because of the success we've had, with them. And to be, like Rachel said, this flagship of how diabetes can be addressed in communities. So.
Beautiful.
Thank
That makes
you.
sense.
Yeah, it does. And they just came out with the new youth juvenile diabetes. It's through the roof again. And a lot of it had to do with the COVID kids. Now they're into the fifth year of sedentariness. So it'll be interesting to hear from the foundation how they recommend starting this. And let me tell you where I'm coming from on it. Just plant some seeds with you. No sixth grader is going to want to come to this program. No fifth grader is going to want to come to this program. No fourth grader is going to want to come to this program. This has got to be littles. Just drop in a 411 right now. Because you go to recruit overweight kids, which is the first thing we notice that is probably associated with it. They're going to be in fourth, fifth, and sixth grade.
Mhm.
And without a family that can really help them understand how important this would be, it's going to be tough.
And it's my understanding from the conversation with Skinny Jeans, it's really not about targeting any one kid because, to your point exactly, it ain't gonna work. But it really is adopting the entire family approach. So bringing the whole family into the program so that you're working from whoever's buying the food, prepping the food, eating as a family, understanding nutrition as a family. That's my understanding of the approach and some of the data they've been doing. I think to your point, we've already seen school-based or individual kid-focused programming and it fails.
It fails. So then total alignment with that. It might be interesting to toy with the idea, we launch programs. What if we launched this one in Spanish? Just thinking with you.
It depends whether
See.
or not we can get
I
the
know.
curriculum development.
I know.
But I'll hold off too much on saying Teresa's already working on a potential partner facilitator so that our regular DPP has a standard Spanish language component.
Nice.
We're just launching that one for the adults right now.
I have no doubt it's going to be pebble in the pond. The word's going to be spread and we're going to all sorts of bilingual, beautiful, can do it. People are going to want to work with us because the word's going to be out. But it would be interesting to have the Spanish language one take the front seat since everything else gets launched in English. Just a thought, not any kind of requirement, but just a thought.
And we can talk with Skinny Jean as the primary leader partner on that to make sure that they're putting that emphasis, since we do know that there's a very high incident rate within the Spanish speaking community.
Absolutely. The Latino community suffers a lot, all the way from having it to not even knowing they have it to not having adequate health care. That's one of the reality at the community collaborative today. It was small. It usually is filled, but there were like 6 people there. And what was being done for all people, but with full on Spanish language efforts. It was so, I started crying as I was saying my comments because it's so moving to see how much we can do when we're united that way. So, okay, enough of planting seeds on that one. I'm very excited about it, that it's coming to a community near us.
I do have a question. Is there like a time?
We don't have a time frame on that program because they're still outlining. I would venture to guess we won't see the launch of this program until at earliest sometime in, I'd go late 26 at the
That's
earliest.
yeah.
Yeah, because they're still trying to pull forward all of the curriculum and some of the other data things that they'll have to put in place for the CDC to even say, all right, go ahead and try and pilot it.
Mhm.
Well, and God knows what's going on there.
I was gonna
What's
say
gonna
it's
happen?
gonna be
So I
difficult
think-
to see a long-term
Yeah.
for pilot funding.
Yeah, so I think in terms of it being a strategic priority, we'll speak of it in terms of developmental stage one. And the reason why check me on why the CDC authorization is important, because it can be covered by insurance,
Correct.
be covered by the family insurance
Okay,
if needed.
but it would be mostly in the afternoon, would be an afternoon.
So I don't think we have any ability to identify what the actual class like schedule looks like, whether or not they do that in an evening, like an after school, or if it becomes a weekend. A lot of that is gonna initially be up to Skinny Jean to identify what and when. And then obviously, once that program is packaged, and it comes to us, we can identify, all right, when does it make sense for our community to come to a class? You know, is Sunday an option? Not if everybody's churchgoers.
And they are.
And if it's Saturday,
Ben is speaking, yeah.
Yeah.
yeah, if it's a Saturday, you know, that gets in the way of a lot of kids' sports, a lot of family times. So if it's gonna be an after-school thing, all right, what are some of the barriers for getting folks from after school?
But if it's
Into-
family oriented, it's gonna have to be family time.
Exactly.
So we have to encourage them to take all that into consideration.
Yeah.
Yeah.
You know?
Yeah.
Because if it's gonna be the family unit's gotta be able to be there.
And I'll jump ahead. I know that we're gonna talk about this a little bit. One of the growing pinch pains that we're gonna have in probably starting this year, going to next year, is as we want more availability for programming in the evenings and weekends, it does mean staffing changes. So we're going to have to address that as well. Right now, we're trying to keep it very tight because the most expensive thing we have are people.
Yeah.
So that is something that we'll look at, but we are very aware of wow, we have a lot of day programming during the week.
Well, and separate from the youth diabetes program, we have to look at that for everything.
Mm-hmm.
The availability for after or weekends and evenings. But you've done the right way, I feel like having it very limited because it's whetting people's appetite now.
Yeah, I definitely,
La, 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 la.
as long as we have something there right now.
Yeah.
People are exposed to.
Yeah, and we're starting cohort 4 or 5.
5, I think.
Yeah, cohort 5. And the fact that each one of those cohorts is seeing a good size crowd in it, right? It's a year-long commitment. There's an expectation and an understanding from all the partners that this isn't where you get 50 people show up for a class every single time. No, no.
Can I ask a data question on that program? Can we talk to them about follow-up? Like cohort 1, we need to know what's happening with them.
We've already, we've had this conversation, so we have within our own, outside of Skinny Jeans, we have our own ability to connect with cohort 1s, 2, and 3s.
Okay, and I like that, but it's not required. When they come in, do they have to agree to a pre-screen?
Yes,
Okay, and a post-screen,
yes.
because we need to know if things are working. I would like to see there, maybe not with this cohort, because it wasn't known. We need, as an organization, to get the big picture. Because if they have satisfaction or success here and second year, and then boom, we may not want to keep investing in it. That's just a fact.
I mean, so far, the CDC's data, the program data has demonstrated that success in this one-year program shows to continued success.
Okay, but I want to know for
out.
us.
Right, I understand that. So right now, we're using that data to still justify what we're doing. We brought this back and had a conversation of how do we begin to make sure that we're staying connected to anyone who's in cohort 1 through 4. We can start to build into our own enrollment. Hey, we want to be able to have you submit information to us on yearly so that we can track this data to find out if it's gonna continue to be worthy of being funded.
Can it be part of the agreement to be able to participate?
I don't think so.
I think that would turn people off.
It would. It also can be, we would have to also find out whether or not that is something that somehow interrupts the program guidelines that are required by CDC. There's not
How
very
did
much,
they get their long-term? How did they get their long-term data?
I don't know. It might be that they're
Study.
following from Medi-Cal or Medicare data where it was insurance funded.
I think it would, especially the Hispanic community has always been very, they don't wanna give out information for immigration status or
Right.
going back to that. So if you're gonna be asking them, they have to do this, they're not gonna.
But they have to if they enroll for the first year. They agree
Yeah,
to
you-
do a pre and a
You,
post.
you make an agreement that you're going to be in the program, and part of that agreement for this program for 1 year is pre and post.
Right.
So it's
Start
easy
there.
for us to be able to say, once you're in the program and you've succeeded, hey, we just know that we're going to ask you on an annual basis, hey, how you doing? Can you give us results on this to see if we're seeing that longevity of success?
So I'm okay with that and with Teresa's and Bianca's work with people. If we can get at least a 60% of each cohort agreeing to giving us data, that would be helpful. Because we're gonna be coming into a money crunch where we're gonna have to decide which programs get what. And depending upon the cost of this program, which I know is many layered, we as a board have to decide what's worthy to continue, and part of that is continued good outcomes. Does that make sense? We can't keep doing a program that 2 years later, should we? Shouldn't we know this? Okay. I'm being too specific about
I
data.
thought we were gonna be using the clinical data provided from the CDC as a major baseline, since
That's
they've
fine.
already undertaken the giant.
That's why we
national
decided
study.
to take a risk with this.
Right,
Okay, that's a nationwide thing. This is Fallbrook, Bonsall, Duluth, Rainbow. We're not that slice.
Yeah, I mean, we can absolutely add in an annual check-in. What we have discovered by launching this is the individuals who go through this have created their own little community. And so they want to stay connected with each other. They want to stay connected with us. I think it's easy because we've already built that relationship.
Right.
We are a trusted partner now.
Right.
We can go back and ask.
Yeah, we
And-
have, the ongoing support group that meets once a month. So a percentage of participants from each cohort roll into that
Yeah.
at the end of the time of the 1 year program, the ones that want that continuing support. So we have like that pool of people that, would probably be willing.
do they
To
share
continue.
metrics in there, or do they just share emotional support?
It's not the full program where they're still weighing themselves every week. Yeah.
So anyway,
Yeah, but they're.
planting seeds, just as a board member, I need more data
Mhm.
on this one, localized data. And
Mhm.
other board members may not need that, that's cool, I can like back up on it. But if we can start getting some long-term data, so we know our investment is paying off for our people, because the dollar we spend there can't be spent here. And we've got some other underserved groups that need attention too, so enough said on that one. Enough said on that one. Okay, increase offerings in Spanish. So we're doing so well on that. I just want to keep the ball rolling, right? Yeah, and I understand about the need for the instructor who's competent, and thank you for looking and seeing and finding on that. And then general category, family offerings. Families need support right now. They always have, but I think they need it more now, and there's subgroups of families, like, I think of 4th and 5th grade parents who have not a clue what's the first kid in their family to be in 4th or 5th grade,
Yeah.
what's coming their way in 6th, 7th, and 8th. Love to see a program that could be addressing things like that.
It'd be nice to have one, just addressing education. 'Cause I know I was the first in my family to go, and my parents assumed once you do 4 years of college, you're done, you're set for life. And when I had to do my 5th year, they were like, really? I'm like, no.
Gotcha. Well, we could partner with school districts on that.
Yeah, it'd be great to have some kind of education for the parents, because they can be, I know that the Hispanic community is a little, they're very divided. There's some that don't really care. They don't want their kids out of school as soon as possible so they can go to work. Then you got the other ones who are overly involved in making their kids exceed, and college is the only way for them to survive.
Yeah, and there's a middle ground.
Yeah, there's always background.
Cindy, do you think sometimes it comes too late? I've had parents say to me, God, Jennifer, I wish I'd known this when he started junior high. Because that's where they get placed into certain ways to move on, you know? So do you think the 5th and 6th grade level is the right one to maybe explore?
Yeah, I would think so, because once you get into high school, you get AP classes. Now they got,
International Baccalaureate.
So there's different kinds, and I know that that's not something that's well known.
Well, maybe we could do some partnering with the school district and co-host some nights.
Yeah.
Yeah.
That'd be good. Yeah, 'cause I know the high school has their, ETA or ELAC.
Yeah.
Yeah, they have that, but they don't really get a lot.
Yeah. Yeah. Okay, well, good seed planting. Thank you. Okay. Whether that comes to fruition in 25, 6, yet to be determined, but I'll be keeping an eyeball out for opportunities and we'll talk about that.
I was gonna say that we're gonna need more than a year to launch a program.
Oh, yeah.
So
Yeah.
since this is so vague and school districts are not easy to initiate a program with.
We're not talking about a program necessarily, we're talking about an evening of information. At least in my mind.
Was that about obesity or education?
I am not certain of the goal for this, so this needs a lot more fleshing out. So before I can say, I'm comfortable saying there's a deadline on it.
There's no deadline on it. It's in the general category of family offerings.
Okay.
Okay?
And
Just
work
keep
to
that.
work to expand support around families in their understanding of the education opportunities.
You know, I
and-
wouldn't even go, this was a blue sky thing going on here.
Okay.
Just let it percolate. I'm not thinking we take that level of detail to our colleagues.
But just the fact that we are going to be working on bringing
Family
more.
offerings.
Okay.
Okay, and it might be an evening of family-friendly physical fitness. It might be a morning of preparing your preschool kid. You know, it could be these one-off things. It's not gonna be a program. There's not enough there to do a program. But I think there are some things that with the health district moniker and the school district availability, we could launch some cool things. But let's just leave it on the table as an idea. Not to be advanced in any way at this time. We want to get our colleagues on family offerings general.
Yeah.
Yeah, okay.
Okay, I can.
Yeah, don't panic. We're not talking next.
I'm all, I need directions, expectations. I'm not sure what we're talking about here. I got a lot of notes that mean nothing, so.
Then
But
let's-
family offerings I can get behind easily, yes.
Okay, I
Yes.
was gonna say, we could take that off as a category.
No, family offerings, I think we already have an
Yeah.
agreement
Okay.
on. It was
Alright.
just
We were
exactly,
We're veering off.
yeah.
Yeah.
Y'all were going down a rabbit hole.
No, well. Okay, Alice.
I'm saying.
Okay, all right, so knock knock. Are there any other categories that we want to say are strategic priorities? Or is this enough in our Easter basket?
Speaking of rabbits, that's plenty for our Easter basket.
Okay. Good one. Okay. So you've heard us talk about getting more clinical services here,
Mhm.
i.e. more access to ongoing care.
Yeah.
And we already have some pieces in place.
Mhm.
I've learned a lot about those pieces. Do you want to give like the big overview?
Sure.
just the big overview, like
Sure.
the whole MOU with Tri-City that we signed in the eighties, it's such a gem.
2013.
Like I said, 2013, it's such a gem.
Yeah.
That we had that already. So go ahead and
So
spill the beans.
obviously, I think it's fair to say that since the closure of the hospital, there's been a community desire for more clinical services. We didn't even need to do the community needs assessment to show that that was true, but we did, and it proved it was true. So as we plan for the next one, I'm going to venture to guess it'll continue to say that. The feedback we get from the community is that they would like more access to healthcare, primary, urgent, and specialty. So the conversations with partners has been, how can we bring an established entity here that has that capacity? And so we've spent quite a bit of time, and we've finally identified, I think, a potential partnership through Tri-City and a couple others that can bring up an existing set of services and bring it up as a package to serve the district's sphere of influence. The research that Judith did now, almost 3 years ago,
Yeah.
when we were looking at various urgent care companies, how could we incentivize them? The same data continues to hold true when we look at the development of the district, really where you see this type of business being most successful is right at the 76 and Mission kind of area, right? That the end of Fallbrook, the start of Bonsall, right in that zone. So we're talking with partners to find out how could services be brought there. When you start thinking urgent care is understandable what that is. More primary care that can be acceptable to all. What entity could do that? So we're trying to make sure that they're wrapping that in. And then lastly is specialty. And there isn't enough population to support any specialty being here permanently. But if a partner could bring in rotating specialists so that on Monday, cardiology is here. On Tuesday, ortho is here. On Wednesday, gastro is here. That would be a huge leap of support for the community. So those are all in-depth parts of the conversation we're having with potential clinical partners. And I'm hoping that before the end of this year, we will be well underway with contracts and such for those services. But the other partners have not quite gotten there yet, so we don't have anything to bring forward because they still have to do homework on their side.
So not only is this a response to an ongoing need, it's also on here because it takes a lot of staff time to figure these things out. So this is not only a financial or goal kind of thing. It's also protecting staff from being so overloaded by doing preschool. She started twitching her leg over.
I did.
We gotta make sure that the bite is right. And so even though this may take 18 months to give birth, it needs to be on the radar so that we all know somebody's working on it.
Yeah, I mean, and Cindy, just to bring you up to speed, we have been working on this diligently for at least 3 years.
And it's
It's
been a little bit
yeah.
Don Quixote fighting the windmills, but you
Yeah.
have been so tenacious and the different connections you had already made, it's really paying off now.
Yeah, I mean, we've reached out a lot of different directions. I mean, Judith did a bunch of homework to get the initial urgent care data. That then led down another track that she was able to kind of get a door open that initiated a conversation. It's just sometimes it's not the right time for an entity. And unfortunately, I think that's where we've seen most of those conversations end. And then we had another door open that we've had an opportunity to say this might actually be the right fit. So we're going to explore it before and make sure it's viable, not dead on delivery, so that when it gets to you all as board members, you can understand that we've done the diligence to say this is a viable partner. It's financially feasible. They have the right capacity so that when it does come to you, you're not like, oh, this sounds great. Too bad it's not going to work, kind of thing.
No.
Yeah.
Makes sense. Yeah. Okay, cool. All right, moving to facilities. the kitchen and the ramps. Is that kind, since we've gone through 3 years of major, wow.
Yeah, so I have been meeting the last couple months on trying to find general contractors that are able to handle these projects. When I say handle these projects, I mean, these are small projects in the big world, right? So the fire district, when they're building a fire station, it's a multi-million-dollar project, right? GCs are happy to take over that. When I come in with a project that's $200,000 and it has to be prevailing wage, suddenly the pool shrinks. And that has been where we were stuck. Our previous contracting process from legal was overly cumbersome. Alex was able to bring in a much more current process, and that has opened the door for us to have better conversations with potential contractors. So I think that we are much closer. I have 3 estimates right now for the ADA sidewalks and ramps. I'm waiting for a little bit more information, but I'm anticipating that I'm going to bring a recommendation to the facilities and board in August to move forward with a contractor for that one. So once that project is done, this like Logic parking lot can finally be signed off. So everything has been a set of dominoes.
Yeah. Good. Okay, well, I'll tell you from a strategic planning point of view, the progress on the district facilities has been fantastic, to state the obvious. So
It definitely looks a lot better out there.
Oh my gosh, it was like a little.
Yeah, poor little, property had been,
Yeah.
a lot of deferred maintenance.
Yeah.
Wow.
Okay, so expansion of current services, that our wonderful navigator, Kaya. In my conversation with Rachel, we were talking about the possibility that seniors are gonna need even more because they get bounced off of Medicaid now. Their social security is late, it's wrong, all the things that we're afraid are gonna happen. So we just wanted to raise it. Do you still think we should raise a flag on that or just?
I'm not so sure I'd raise a flag that it's specific to seniors. I would say that the concerns around Medi-Cal and other potential entitlement, quote unquote, programs, having Katya be fully up and able to look at what that is going to include. Keep in mind, we have been grant funding the Foundation for Senior Care, who handles the senior part specifically.
Okay.
Which is why I think I lost that contact there. But making sure that Katya has the knowledge around and skill and resources to be able to talk to folks and help them navigate through a uneasy Medi-Cal world.
Why don't we just leave it at navigation services? Because it includes the food pantry, the food shortages that are
Right.
going on, the Medicaid, the Medi-Cal,
Right.
the confusion on social security. Let's just speak in terms of expand navigation due to budget constraints beyond our control, something
Yeah.
like that.
And that makes a lot of sense. Luckily, it's been the last couple months has been a little quiet for Katya. Yay, we're glad. She still gets a case that's always very complex. It's never just a single need. So we have been, I know Teresa, I shouldn't say we, Teresa has been making sure that Katya is going to county trainings, getting connected. So making sure that she is out at the schools to make sure that those families know that she's a resource for them to be able to go to. And that's been successful over this last year or so. Keeping up, making sure that she's involved and able to do those things, make sure she's continuing on her training. She is a master's program, so she's learning more things and she's taking what she's doing with us into those classes. So I say the more we continue to invest and push her skill set, the more we're going to be able to support the community through these navigation programs.
And then mental health services, access and support, we had thought deserved a nod in strategic priority.
Yeah, and you all just actually supported that at the last board meeting with the expansion of the MOU for Hospice of the Valleys and the bereavement support. Because we saw a lot of that come out of COVID, where a lot of people passed away shortly and there just wasn't enough mental health support. Between what we're doing with Palomar Family Counseling, what we're doing with Hospice of the Valleys, our regular mental health first aid programming had been quite successful. The challenge we just discovered is that the county cut all the funding to that entity, and so that entity is no longer going to exist.
Wow.
Which means we don't have a provider for that. To resolve that to some extent, because this program has been successful for us, Teresa reached out to not only the entity that we were working with, but some of their instructors that are already trained and can offer these certifications. And we may offer limited contracts and pay those groups specifically so that we can have access to those modules.
Oh, good.
Getting trained through the mental health first aid program itself takes quite a bit of time and resources that we don't have to invest.
Let's use people who already know.
Better to use people who already know.
And it's good for them too. They just lost a huge,
Great.
yeah.
So we can
I
work
think
with
that's
those
great.
individuals. We are bouncing around a couple of ideas about some committed volunteers in the community who we might be able to provide access for them to become trained. So we're looking at what it would take for us to have that volunteer pool set up, and what potential liability that would bring forward and all of those pieces. So we're looking for ways to bring that program to life here since it was successful for us here.
Perfect. I say build on success. And having been to one of the first aid, mental health first aid for a brief period of time, it's very impressive and very resonant for people and offered in Spanish and English.
And with specific modules for, first responders or for youth or for healthcare providers. Because those curriculums have already been developed and because there's individuals who've already been trained on how to do it, it makes sense for us to put the resource into them instead of us trying to rebuild it from scratch.
Amen.
So
Good. Okay, so that might be maintain.
it,
We'll leave
I would say it's still expansion.
Okay.
Katya's been doing this now for 2 years with us? So she is still learning. We are still able to expand. I think that she has capacity for more support to individuals. The fact that we're getting her trained up in more and getting more resources, I think that's going to be a forever situation.
Very good. Okay, and I know you're familiar with LAFCO.
I am.
Okay, so that could take a lot of time, although we did our bit already. They're digesting it, right?
Right. They'll be providing us with the draft of the MSR sometime this fall is my understanding. When that draft comes back to us, I think first we'll do a review to make sure that it's fitting and accurately reflects what we do here. Then obviously it will come to the board for you all to be able to review to make sure that you feel it is accurately reflecting what we're doing. And then we can send it back. I don't expect it to be a very lengthy process for us.
But time and attention,
Time and attention.
very important.
Everything is time and attention.
Given Palomar's situation and given Grossmont's situation, everybody seems to be falling apart on their spheres of influence.
I mean,
Okay.
yeah.
Okay. And then, Rachel mentioned this earlier, strategically, we need to take a look at the way we're allocating our available funds and our investments.
Yeah.
Because if we're gonna move to more clinical services, there's a possibility we may need to provide startup funding for that. Fair enough?
More than likely.
Yeah, and so that may reduce our ability on community grants. So we have to sit down and figure that out and then come to the board. And that'll reside mainly in the finance committee. And we'll start to work on that. It's a good problem to have, we sold the hospital and we had that chunk of money and look what we did with it already, and it's invested well and it's growing, so it's a seed pod.
Right.
Yeah,
It's just, we have a finite piece of pie
yeah.
that, you know, cutting it up for the investment in the wellness center, which we're deep into, the programming for that. It's fair to say that clinical services, outranks almost all the other things that we want to do. So then what happens is you get to the leftover of what's discretionary, right? By law, we are required to have solid reserves, so we must identify what that is. Currently, our reserve policy is more than over generous, so we can parse that down quite a bit. But it leaves the grant funds.
Yeah.
And as much as that is a thing everybody loves, there comes a point where you have to make a Solomon-esque decision of where do those funds go?
So that's a good thing to do in 25, 26. Figure
Yes.
that out. I want to go back up to program development. You've heard us talk about the Catalyst community survey that we use to launch many things down there.
Mhm.
Up under program development, define and release an RFP for community needs as interest assessment. We need to do another one. That one's 6 years old now.
Coming on to 6.
So, and in my view, we want to do it, as well as and better than the Catalyst.
Right, I mean, we had a different focus for Catalyst. I think a true community needs assessment that can provide us more granular detail about community need. That's what we need now. We know how to launch programs. We know how services should function out there. Catalyst did that part of the report for us. We don't need to do that part again, but we do need a lot more granular detail about, you know, what, and Judith and Teresa and I just had this conversation this week, you know, what percentage of our population has this need? Well, if that is a large population and it's a big need, that should be weighted more heavily than, well, this would be nice to have.
If we can do it well.
As long as we can do it, yes.
Yeah, no, this will be exciting. It's kind of like an MRI of our community. See what's going on in there.
Right.
So any other topics come to mind, Rachel, or does this cover the waterfront?
Oh, I think it's plenty.
Okay, and it's the right things.
I think it is the right things. You know, we are going to, this will be a good year for us to be in flux and identify, you know, these are priorities we're going to start to outline. The reason that we're not doing the community needs assessment this year is it has a price tag to it. And we're already in this fiscal year's budget and I don't have it budgeted. So taking this year to identify what we really want that community needs assessment to tell us. Then we can put out that RFP probably in spring of 26. That way I'll have an idea of what it'll cost. We can build it into the 26, 27 budget and launch it then. It'll take good part of 26, 27 to do that. And then in late 20 or probably early 27, looking at the 27, 28 fiscal year, we can then start to implement from there. That should give us a really realistic sense of what do our finances look like. Bulk of the buildings and such over at the wellness center should be either complete or at least underway. So we'll have I think a more clear idea of what resources do we have to put toward these other needs. So even though this is kind of listed as our current priorities, we're not going to launch that community needs assessment immediately.
Yeah.
We need to be very clear on what we want that tool to do for us.
And you know, this is for 25, 26, so could be the 26th of it all.
Exactly.
Yeah.
Yeah.
Okay, anything we've missed, Teresa, from your perspective that will support you?
No, I think having some of these strategic guidelines really helps us to know the priority of the programming and what to target and to feel like we're really, you know, in line. So I look forward to, you know, to having, you know, this kind of a document. Yeah.
Cool.
And priorities.
All right.
Any other comments? I do have a question. How many Spanish speakers do you guys usually get in these programs?
A lot of times it's lighter than we would like to see. So I would say, a lot of them, it could be anywhere from like 3 to 12, and once in a while we'll end up with nobody for some of the Wellness Wednesdays.
Oh.
But so we're still building, like that relationship, but at the same time, if we don't have something to offer, what are you coming for? So we're using the diabetes prevention program in Spanish to really deepen a lot of those relationships. We're working with a couple of churches in town, trying to do presentations. We're gonna pull out all of our, allies in the community and ask them to, help us, get the word out about it. So we have a lot that we're gonna put towards this as a real effort to help deepen that relationship. And we have some other things coming out around the same time in Spanish. So if one thing's not a fit, hopefully something else will be, some of the other programming.
Awesome. Yeah, the diabetes one is definitely a good target. It's for that community.
Yeah.
And one of the challenges we have are the folks who are coming out to some of these other programs. They're probably more bilingual than they are just Spanish language.
Mhm.
So they're able to access the folks who are purely Spanish language only. This will be the first program we'll ever really be able to truly tap them. We've had one-offs in several of the other programs, but it hasn't been a consistent enough to really, I think, draw in that part of the community. So that's where, again, a lot hinges on this cohort of DPP.
And
A
when
lot.
is that so far launching again?
October 7th, I believe.
This year?
Yeah.
Yeah, so we've been,
So they've been doing a lot of pre-work.
On-ramping.
Yeah.
It's a very long on.
The marketing saying, tell them once,
Yeah.
tell them twice
Yes.
another way, tell them 3 times in another way, you might.
Yeah.
Right, it's the rule of 3.
Yeah.
So going to the churches, insert into that Hispanic informer that came through, there's as
Yeah.
many as possible, because it doesn't get in
Yeah.
the first time.
The only problem,
The timing right now is the unfortunate part.
right,
There's a reduction of attendance across the board to like visits to doctors, attendance to churches. Across the board, there's just a reduction of attendance to a lot of things right now. So that's why I was like, oh, if it's this year, we may not get the most perfectly accurate data.
yeah.
But hopefully we could get on people's radars
think
by
we will.
doing this, and that what could happen is like, let's say like next year, different environment, different time, all of a sudden it's like, we offer something and boom, we have, like, where did all these people come from? Because they've been listening and it's been going on, but now's the time, when we might see more people at events. We've been building our email database, so we are communicating in Spanish every month. You got added on that, right?
Yeah.
Yeah,
I'm on.
I added, yeah.
I got my mom on there.
Okay.
Good.
Because I know I wanted to add it, so.
I was like, she has a lot of.
Good.
Yeah,
The cohort we're looking for the October, is it a cohort of what?
you know what,
Is it
10 people would be amazing.
10 to
10 to
15?
15 would be great.
Yeah.
Okay.
That would be
So-
successful. Yeah.
Okay, so, yeah, the rule of 3, we just gotta drill in enough to get 10.
Yeah, and I wonder, I think with this program, maybe this first year, maybe it's not the Spanish only, but you have a lot of people. I mean, if it was me and I was someplace else, I want my health, information in my native language, my first language. So I think I think we will have, people coming in. When we first sent out our very first little dip of like, hey, what's coming? The next day I got a call where someone so excited and wanting to tell all their friends, and she's enrolled and got me, was trying to get me in to speak to one of the churches. And so, I mean, that was very encouraging to me. Yeah.
So, with the Vista Community Clinic neighborhood, and
Fallbrook, Family Health Center.
thank you, they were all there today.
Mm-hmm.
It was great. They all have that information, so their physicians can be including and encouraging their people.
Yes.
Is that accurate?
Yeah.
Their
I mean, it's
physicians
hard.
don't really
Yeah.
have any say in
Or
it.
their-
It's,
or their
if we can get the
outreach people.
gatekeepers.
Like the
and-
three gals that were there today.
Yeah.
Yeah, there, it is. They each have like different versions of things they might do in, in their own clinic. So it's a little bit of a
Oh, a little
competitive.
competitive.
A little bit. It's, they don't do the same program, but do they have some diabetes education at some
sure.
level? So
How
there's a little bit
successful
of
is
that.
theirs?
Yeah,
But we're partnered to that.
we are.
Yeah.
We are. And
It's
we
a-
are
it's a
working.
different-
Better you're getting some education than none.
Absolutely.
We want you to come to the gold standard, which is ours, but
Yeah,
you know,
Yeah, but yeah, like they have the information. I think Fallbrook Family Health Center is saying they're gonna really tell patients about it and, have information in the office. So that's,
Okay.
the best,
Yeah.
we can
Very
do.
that's a hard nut to crack over there.
Okay, enough strategizing. Now we're gonna go to item B. CRM software.
Right,
Tell
so
us all about it.
I'll give a little bit of background and then Teresa, I know you've got a little bit more data kind of stuff, a little bit, yeah. So Cindy, this is mostly to bring you up to speed. So our client relationship management software, CRM software, right? Almost every business has one to track their client base. The district has used Constant Contact for our email marketing. It is not a CRM. It doesn't allow us to track anything on people, right? Other than, did they get the email and did they open it? One of the main points of data collection that Jennifer has said from the beginning is, how do we keep awareness or data and tracking on the number of people who come to the programs that are exclusive of, right? So we might say we have 1,000, 1,100 visits to the center a month. That's because we don't know that 100 of those visits are the exact same people who come to 5 or 6 different things, right? At this point, we don't have a good way to track that. There's literally, unless we take every paper sign-in sheet and we go to some spreadsheet and go, okay, here's a check mark and here's a check mark, which is incredibly cumbersome and not very likely to give us real numbers. Part of that is we may have Encore, the group, come and they have 50 people come and they do some cards and they do a thing and they do a stuff in the month. They had 50 visits. We can ask them to give us their visitor log, right? We ask them to sign in, but people we know aren't always signing in.
Yeah.
Right. And then we have a class, specifically, let's say DPP. We absolutely know and can control who's coming for that, right? And then we may have a Tai Chi class or a this or that. And so right now we're taking all of these sign-in sheets and we're trying to get them into Constant Contact so we have contact, but we don't have a way to track their utilization. So what that has led to is, let's find some sort of CRM that'll allow us to track that. And so we've been looking at software that park and rec districts use. We've been looking at software that the software that Katya uses for her clients, right? Because that allows us to not only track for Katya who she sees, but what resources they get, and then what happens from there. That's the kind of data we want to some extent for visitors. We also want something that's going to allow us to be able to say, Jennifer Jeffries came for art class, but she's also expressed an interest in mental health first aid. Okay, she's also expressed an interest in this. How do we run a report that says, oh, I've got this thing coming up. She's of an interest and she's of an interest, so that we can now start to target appropriately and then keep track of which things you came to. This is not a product that exists on the market that we have found yet. So I don't know, we've gone through a few different demos, talking to folks, trying to figure out what that looks like. We've also looked at a couple of things that are more traditional business, more Salesforce standard, but it also doesn't necessarily track some of the other pieces that we need. And Salesforce is not an easy tool to use, and it's kind of spendy. Okay, we could probably work around those things if it was the right tool. So finding that balance of, is it affordable? Does it do what we need? And is it actually usable for our staff to be able to handle, right? So there's a lot of research we still have to do. I would say we haven't found anything that's worth the price yet. The park and, one of the biggest hurdles, and we discovered this during COVID, we're not the only ones, but if you don't have an email address, most of these CRMs don't know how to tag you. So we can create a dummy email address. It could be Jennifer number 12 at fallbrookhealth.org. Okay, well, it's not really all that helpful because I might have 500 Jennifers, like a Jennifer 1, Jennifer 2, Jennifer. They don't allow for a unique identifier. And so that's one of the pieces we're trying to get around that doesn't treat everybody like an email address. Because if you don't have an email address, or
Have your resource
You share
navigator
one.
say-
you share one.
Sorry, have your resource navigator hook them up with one.
Yeah, right.
It's like, oh, you don't have one here.
It'd be amazing how many people said, no, I don't want email. But I really want you to have an email.
I know a lot of people don't,
Yeah.
and they will remember their password.
Yeah, and they're never gonna look at it if they did. And that was one of the things we see is we may have a couple where it's the household has one email address. So if I have 3 of you sign up for a class, but you all use the same email, do I count you as one? In the CRM, so we're looking deeply at that before we bring in a substandard product. Because we know that we want to capture the data.
Yeah.
And we need a CRM that can do that.
Yeah, because if we're having 1,000 visitors a month, that's eye-popping and good, right? Visits, not visitors, but maybe it's 700 people. We need to know that.
And we're trying to figure that out.
I get it.
Yeah.
I get it. Okay, well, thank you for the brainstorming. Okay, Q4 CHC grant impact reports.
So you might have seen that your packet was really large. Time.
With my computer.
Yeah. So again, Cindy, because you're the new, so I'm giving you a lot of background. You can tell me at some point, you're like, yeah, I got it. Quarterly, all the grantees must submit an impact report. Because of the form we use, you don't get this nice long narrative, you just get these little chops. But the idea is the grantee must tell us what happened, how'd it go, how many people did they serve, what's the impact. They're also supposed to provide us with an example of the acknowledgement that they did. We've been historically fairly lax. As long as they're reporting, we haven't been overly critical. That's gonna change this year because it is more competitive. Those folks who can provide us a good impact report that says we served this many people, our intervention started here and we did this and this is what resulted. This is how we acknowledge the district. And hopefully they can give us a personal story. So you're not going to see that necessarily in these impact reports because we weren't starting this last year when they got funded. So for the folks that you just approved grants for, they will be given a little bit more of a strict guideline. Raquel and I met today and she gets to be the one who's going to read the impact report, compare it to the application. If there's a gap or they're just regurgitating the same thing, she's going to flag it and provide it to me. And then I get to make the knock on the door that says, I'm sorry, you're going to need to resubmit your impact report. So I'm going to play the bad cop this year so that when we get to the point where we have to be really scarce on grant funds, we'll know who's been providing better grants. And this is better for the nonprofit anyway, because any other grantor out there is asking for an impact report as well. So hopefully this elevates what they're doing here. But we had from a long time ago made a decision that at least the final impact reports would show up in this committee because the grants live under strategic planning. We've done it in different ways where each quarter we select a couple and put them in your packet so that you can see them. But because this is the end of the year one, we wanted you to be able to see those. So those are more for educational and informational than they are.
Well, they also, they also are the accumulation of the full year.
It's the accumulation of the full year.
Kind of get the big picture at the end.
Right.
Great. Okay, well, thank you for advancing the quality. And I agree with you, it's important for us and their relationship with us, but it also hones their skills
Mhm.
in being a good receiver of grants, and that's important too.
Yeah, and I mean, I've been saying it since I came to Fallbrook 10 years ago,
Mhm.
when I first started getting grants from the
Yes.
district, and I was like, easiest money I ever got. And that was true, and that it fit the time, it fit with where the district
Where
was.
the district-
As we've changed, what I've noticed is many of our nonprofits have just stayed in that same mindset of, well, this is easy, I'm just gonna regurgitate the same thing every year. And it doesn't seem to have sunk in, even though I do a training every year that says, hello.
Yeah.
But I would say the last 2 years has been more competitive. And more agencies are not getting funded because what they provided us was not a good application.
It was like, there, it was air.
It was very fluffy, but there was no substance that said, we're going to be able to make an impact, or we're going to be able to support this community, or this is how our impact can ripple across. Without that, can I justify giving you $20,000 and not doing additional navigation services where I can track the data?
Right.
So, we've invested more and more in district programming. The grants began back in the day because the district didn't have programming.
Right.
So as we're shifting that, the money has to go with it. So that's a long story on why you have so many impact reports.
You have them all.
Why you have them all in there. Yeah. So it is our, we are required to be compliant in tracking this per our own policy. It's public money. It's important for the public to be able to see where that money went. So we typically will also then have these impact reports on our website. The application's on the website and the impact report is on the website. So if the public says, I don't like who you're giving money to because their impact report is terrible, we can say, you're right. And we've spoken to the grantee.
Not many people sit in our.
No.
But I get what you're saying.
I mean, I always have hope that someone is going to.
But also if somebody comes to us, we have to.
Yeah.
Exactly.
We're doing it. We're very glad.
If the public isn't mad at us, good,
Yeah.
we're doing our job. When they get mad at us, it's because there's been a change. And if there's been a change, we need to demonstrate that we've done our due diligence, we've done our job. This is the reason the change was needed. And somebody's gonna get mad. Somebody's always mad.
This is true. Okay. My fellow board member, do you have any comments or requests or suggestions?
No, but I feel like you guys have a lot of homework.
Like this.
Got my notes.
Yeah, her notes look worse than my notes this time, right?
Okay, and we'll see each other, July, August, September, we'll see each other again. Oh, well, we'll see each other.
2 weeks.
Anything else for the good of the cause? Ready to go home and have dinner?
Mhm.
Adjourn.
Thank you.
6:33.
Go home.